Good afternoon. My name is Alan Unell, and this series of videos is called Healthcare Reform Advocacy. Each video tries to address a problem in the healthcare system and provides actions that we all can take to help make the system better for all of us. Today, I want to talk about some legislation that's going to be introduced in the Senate. The bill is going to be marked up on the 21st to address primary care access in healthcare. We have a problem in the United States. COVID-19 kind of brought it to light, but doctors and nurses are under high stress. There are a lot of reasons for it. I don't want to go into all of them here. There's a lot of pressure on them to see more patients. Nurses are underpaid. I don't know if you've seen all the strikes that are going on lately. It's not good. And we have a situation that just becomes a pressure cooker for them, and a lot of them don't want to continue, and so there's not enough primary care access in the United States. It's true in rural America. There are about 20% of us live in the rural United States. That's about 66 million people. A number of us live in urban areas that are medical deserts where it's just hard to get to a doctor. Like it takes quite a while. I'll tell you, a friend of ours lives in northern Washington, and she had to go for eye surgery recently, and she had to take buses and a ferry, and it took her, I think she said it was going to be like 2.5 hours just to get to the doctor. This is like craziness. That's not much medical care. It's really hard. Anyway, let me give you some background. GoodRx is the pharmacy coupon company. They did a survey because they're good at data. They did a survey of some data that was provided by the U.S. Health Resource Services Administration, the government agency. And what they found is that about 9% of the U.S. population lives in a medical desert where there's one doctor for every 10,000 people. I know that sounds gigantic, and it is, because normal, get this, is one doctor for 3,000 people. I don't know, that sounds like overload too, but 1 out of 10,000 is horrible, and they're hard. It takes a long time to get to a doctor, and so people don't go. And as a result, they typically get sicker, and when they do get to a doctor for something serious, it's often way late and way more difficult and expensive to fix, and that's not the best medical care you can give anybody. Anyway, what do you do about it? Well, how bad is the situation? Well, I said it's 27 million people that don't have ready access, but we have a shortage of doctors and nurses in the country. It's estimated that in the next 10 years, we're going to be short 120,000 doctors, and a lot of them are going to be primary care doctors. We have a nursing shortage. It's even worse. And over the next 2 years, the estimates vary between 200,000 and 450,000 nurses will be missing. That is, we could have slots for them, but we won't have the nurses. Between 200,000 and 450,000. That's incredible. So to address this, Senator Bernie Sanders, who's the independent senator from Vermont, and he's chairman of the Senate Health, Education, Labor, and Pensions Committee, and his colleague, Senator Roger Marshall, who's a physician. He's a Republican senator from Kansas, and is the ranking member of the subcommittee on primary health care and retirement security, announced last week they came up with a plan. And what I want to do is describe the plan to you, because I think, it's not my solution. My solution is universal health care, which builds out the budgets for lots of health care all over. But this is a good first step. So let's talk about it. The agreement is going to provide about $26 billion in funding to expand primary care in the United States and address the healthcare workforce shortage. It's going to provide $5.8 billion a year over the next 3 years in mandatory funding for community health centers, and they provide high quality primary care to more than 30 million Americans. It's going to provide $245 million a year set aside to expand the hours of operation at the community health centers. If people are working, you got to pay them. And it's going to provide $55 million a year for school-based health services. That's really important. There are so many schools that used to have nurses, and the nurses are gone. There's no care available. You know, it's also a place where you could vaccinate children. Health centers are also going to be required to provide nutrition services. That's going to be critical in a lot of the lower income places where they are. It's going to provide $3 billion in capital funding to enable community health centers to expand to include dental care and mental health services. You know, if you don't have a primary care physician, you probably don't have a mental health care professional either. It's going to increase funding for the National Health Service Corporation Corps from $310 million to $950 million, more than tripling the amount of money available over the next 3 years to provide 2,100 scholarships and debt forgiveness to some 20,000 doctors, nurses, dentists, and mental health care professionals and other health professionals who commit to working in our nation's most underserved areas. It's going to provide $1.5 billion over the next 5 years in the Teaching Health Center Graduate Medical Education Program to create more than 700 new primary care residency slots. That'll result in 2,800 additional doctors by 2031. It's going to address the nursing shortage, remember how horrible that was, by investing $1.2 billion in grants to community colleges and state universities to increase the number of students enrolled in accredited 2-year registered nursing programs. This is going to allow schools to train up to another 60,000 additional 2-year nurses. And it's going to provide $300 million to produce an additional 2,000 primary care doctors by 2032. There's more that the program is going to do. And quite frankly, they have an interesting program for helping to fund it, which I think is great, is they're going to go after pharmacy benefit managers and how they scheme and cheat the U.S. government by jacking up pharmacy prices that the U.S. government has to pay. So I think that's just excellent. Anyways, so let's recap. The bill trains and makes more doctors available and more nurses available. It builds out facilities to provide more care, and it's going to help fill the gap that looms before us. Is it perfect? No. Is it a good first step? Yes. So what's the action we can all take? Let's let our senators and representatives know that we want them to support this legislation as it becomes available. I'm going to put in the comment field below, or in the description field below, a link to this write-up. It's going to have links to the sources. It's also going to have a quick script that you can read if you want to call them. There'll be a link to get the phone number or email for your representatives and senators. Or you can use ResistBot from your cell phone just by texting SIGN PEJGSU to 50409. That's pretty much what I have for you for today. What I'd like you to do is get in touch with your representative. Make sure you like this, if you like it. Share it. And if you have any comments, put them in the field below. I'd love to hear suggestions from you. Have a great day.